Hello, I'm Joan with Iridex Corporation here at the American Academy of Ophthalmology. It's Iridex's day one of our 3-day Physician Speakers program celebrating 20 years of our MicroPulse technology. I'm standing here with Dr. David Gossage, director of the Gossage Eye Institute in Hillsdale, Michigan. He just presented on his experiences using MicroPulse technology in his comprehensive practice. Dr. Gossage, thank you for being here.
My pleasure.
Can you tell us how long you've been using the IQ532 laser and the various ways that you have incorporated it into your practice for both continuous wave and MicroPulse procedures?
Sure. Back about 6 years ago at the Academy meeting, I was looking for a new laser to kind of replace my water-cooled laser. And at that time, I came across the Iridex booth and purchased the laser. At that point, they started the MicroPulse with the 532. And from there on, I've been using the MicroPulse now for probably 6 years. I love it. I use it from the anterior segment as well as the posterior segment. I can treat glaucoma with it by doing a MicroPulse laser trabeculoplasty. I can also treat the posterior retina for macular edema, whether it's due to diabetes, branch vein occlusions, central serous retinopathy. All those procedures can be carried out with the MicroPulse technology. Now, the nice thing about MicroPulse and Iridex itself is that there's also the continuous wave laser that goes along with it. So you get the ability to use the continuous wave laser when you need it, such as doing PRPs, maybe focal ablations of choroidal neovascularization, cutting a stitch. So you have that technology available for you, and then you can switch it to MicroPulse and be able to use the MicroPulse for treatment without creating destruction to the tissue.
And how has MicroPulse benefited your patients and your practice?
Well, for several reasons. It's definitely a benefit to my practice because now I can offer more for my patients than just a traditional laser. I can now use a laser that can help lower their intraocular pressure or treat their macular edema with MicroPulse without creating any thermal destruction to the tissue. Therefore, the patients do well. They don't have any risk to their eyes that you would have with maybe a continuous wave laser. So in this situation, it's great benefit to my practice because it just offers me a wide range of treatment, especially as a comprehensive ophthalmologist. It gives me the ability to do things both from the anterior segment as well as the posterior segment, and I feel comfortable with it, feel confident with it, and I've been very happy over the past 6 years with using it.
And so what would you say to a colleague who is still very skeptical about MicroPulse technology?
You know, that's a good question. I think a lot of times colleagues are concerned because they don't really see an effect going on. I think what I would do to them is say, look, try the technology. You have nothing to lose and only to gain from what it can do for you in your practice. It's an excellent technology, it's a safe technology, and the first thing we learned in medical school is to do no harm. And so with this, we know we're not going to create harm with MicroPulse technology. And as you know, looking at the booth here today, there's been a lot of new studies using MicroPulse technology and actually seeing some of that effect that takes place in the tissues, and I'm very excited to see that, and it's pretty neat because it kind of justifies what it's doing for us.
Well, thank you very much for being here and taking a few minutes to talk with me.
Thank you.
Thank you. We have additional talks at AAO. You can find our complete speakers program at iridex.com or stop by our booth 2545 to pick up a schedule of all physician presentations. We also invite you to stay connected via our social media channels for the latest news and additional videos.